This conference will now be recorded.
Today, we are going to discuss in Charaka Samhita Nidana Sthana about Kushtha Nidana, with its some sutra regarding management of particular skin diseases. Here, we have to consider this Kushtha not as leprosy, but the obstinate skin diseases. Means all type of skin diseases, according to Ayurveda, are Kushtha. Why Kushtha? We are going to see in the Nirukti. First of all, we'll see what is tvacha, that is skin, according to Ayurveda. Now, see, the important perception of sense of sparsha, that is touch, is perceived by the skin or tvacha. Especially in tvacha, Vayu Mahabhuta, that is Vayu Mahabhuta out of Pancha Mahabhuta, and Vata dosha are dominant. We know this. As well as it is the site or sthana, location of Bhrajaka Pitta. Now, the function of the skin or tvacha, according to Ayurveda, eliminates kleda. Kleda is the abnormal liquid from our body in the form of sveda. Now, there are two types of mala. We know that the sthula mala and the drava mala. So, the purisha mala is the sthula one, and the liquid one are two. This is urine and sveda. That is the mutra and sveda. So sveda is removed outermost part of the body, that is the tvacha. Now other functions according to Ashtanga Sangraha: permeability, perspiration, secretion, and touch sensation. So these are the functions of the tvacha. Now over the tvacha, we use this route of administration of drug, especially for Bahiparimarjan Chikitsa, such as Lepa, Abhyanga, etc. Now, about the skin disease, there is a lot of scope for Ayurvedic, especially management. You can become a specialist of Ayurvedic skin specialist, because the modern medicine treatment have recurrences about the skin disease. You know that the skin disease have many more scope and many more number of patients also. So coming to again point, all skin diseases are included under Kushtha, that is the Tvacha Roga. Causative factors which we nowadays are very common, and that's why we are seeing large number of patients about the skin disease. The causes, especially causative factors about the food, about the behavior, Rutu Viparya, etc., vitiates Tridosha, and Tvacha, Rakta, Maunsa, Ambu or Lasika are vitiated male. Ayurveda has described in Charaka Samhita 18 types of skin diseases. We are going to see those details. Now see, just at a glance, we are seeing some glimpses here. Charaka had described all varieties of Kushtha are due to Tridosha Dushti, that is simultaneous vitiation of Tridoshas. Some doshas are predominant and the others are not. But the Tridoshas there are there, and the dominant one, whether it is one or two, accordingly the name are given, accordingly the treatment or the management of the diseases are given, particularly that type. Now, what are the symptoms? These symptoms are Pitte tu Audumbaram Vidyat, Vata Pitte Shleshma Pitte, then Rushya Jivam Pundarikam, Pama Sataru Vispotam Dadrushcharmadalam Tatha Pitta Shleshmadikam Prayaha. Some references are here from Chikitsa Sthana. You see, what these things makes us, that even though the nomenclature is according to the vitiation of dominant doshas, the line of treatment is always on the basis of vitiation of the doshas. Whether it is Kakanaka Kushtha or Rushya Jiva, that means Mahakushta or Kshudra Kushtha. Main, we have to focus on the Tridosha. What is the imbalance of the dosha? Which doshas are imbalanced or vitiated? In short, the treatments are given, especially here the Pitta Pradhana Kushtha treatment is given, that is the Virechana. Next, if we go in the review of Kushtha from the history, we will find from historical Vedic period this disease was having its existence. In Veda, especially Rigveda, Vivarnata, Romashatana, then in Yajurveda, herbs for Kushtha are described. In Atharva Veda, Kushtha, Kushtarupa Varna, like these words are there which are indicating that the existence of skin disease were from a Vedic period. Now in Mahabharata, Tvak dosha, having Tvak dosha person cannot be a king, that is mentioned. That means that time also, Mahabharata period also, the skin disease was there. In Purana, that Agni Purana, the Khadira is used for Kushtha. Externally, Hartal and Manashila, these minerals are used. In Smriti Purana, the etiology and the treatment of Kushtha is also explained. Then Charaka Samhita, we know that Nidana Sthana 5th chapter and Chikitsa Sthana 7th chapter are totally dedicated for this skin diseases diagnosis as well as the management, that is the treatment. As well, many more scattered references are there. Now in Vela Samhita, Nidana Sthana 5th chapter is there separately for Kushtha. In Harita Samhita also there is separate chapter. In Sushruta Samhita, Nidana Sthana 5th chapter, Chikitsa Sthana 9th chapter and Chikitsa Sthana 10th chapter are dedicated for the Kushtha management. In Ashtanga Sangraha and Ashtanga Hridaya, Nidana Sthana 14 and Ashtanga Hridaya also Nidana Sthana 14. And in Chikitsa Sthana, Sangraha, Chikitsa Sthana 21 and in Ashtanga Hridaya, Chikitsa Sthana 19 are the chapters from the skin diseases. Now, why we have necessary to compile these all references together? See, even though we are here discussing about the Purvartha, just Nidana of Kushtha disease, we have to see the other textual references and the management also. Then and then only we can treat properly the treatment, because the contribution of other Charakastu Chikitsite, it is right, but there are some other contributions of other we can say classical texts also, such as Sushruta Samhita, Ashtanga Samhita, Hridaya, etc. In Kashyap Samhita, we found scattered references of the skin diseases. In Chakradatta, which is written by Chakrapani Datta, is also Kushtadhikara chapter is separately. In Sharandhar Samhita, which is dedicated for the herbal formulation and from Brihatrayi, it is Laghumanjishtadhikara and Panchanimba Churna. These are indicated or prescribed for specially skin diseases. In Bhava Prakash Samhita also, some causes are described, such as impure drug intake causes. In Madhav Nidana, that is again a Sangraha Grantha from Laghutrayi, that is the 49 number chapter is dedicated for Kushtha. Now, after seeing this review, we can see that the almost all Brihatrayis and Laghutrayis are mentioned about the skin disease. Itself, it represents the severity of the social problem in the society about the skin diseases also. And even though when we will go the details of types also, you can see that there are 18 types of skin disease. None other disease is described so much variety of its shades. Okay. Kushtha Vikara in general now we will see, like etiology, etc. So all dermatological disorders are labeled as Kushtha in Ayurveda, which produces psychosomatic embarrassment due to the blemished skin, and hence it is named as the Kushtha. Kutsite tishtati kyu kushnati angam angani va. That means when the skin disease is there, whether it is over the visible part or invisible part of your body, that means the patient's body, the person doesn't have only the physical problem, but he or she has a psychosomatic problem also. After that, we will go to the now textual details such as nirukti or etymology, which makes the skin abnormal, causes discoloration and ugliness, produces exudation, putrefaction, is kushtha. Now this producing exudation or putrefaction is a very severe or chronic stage of a disease. It is not having, especially initially or at the just appearance of that or the starting of the disease. Now this is again the Kusha dhatu is there, which means whatever comes to outer side from inner side of the body, that is Kutta. Again, the definition, when the provoked three doshas and vitiated four doshas, that is Tvak, Rakta, Mamsa, and Lasika, became imbalanced, it makes the skin flabby and slowly it fall out. That caused the discoloration of the skin, and this all scenario is called as a Kushta. So we got here that the dosha dusha sangraha. See, totally they are seven. Now, what is the sthana? We have seen the Sushruta has explained that the fourth layer of the skin, which is called as a tamra, and the fifth layer, Vedini, those are the sthana of the Kustra. Charaka Samhita has mentioned about the fifth layer, that is the Vedini. Now, here in Nidana Sthana, Samshepataha Kriya Yogo hi Nidana Parivarjana. That's why we have concentrated here, and you have seen the huge compilation about the hetu or the causative factors. Because if we will avoid the causative factors, the disease will not happen. Okay. As well, when the disease is there and the causative factors are avoided, then the disease curance period will be less. That means, sure, within a fraction of or a fraction of a period or certain weeks, even the chronic skin disease can be also cured totally. And as well, the relapse of the disease will be not there if the causative factors are avoided. Now we see the first hetu, that is the excess consumption of test, particular rasa. Now Charaka Samhita has mentioned that Lavan rasa, that is the saline test, is causing the skin disease. Means especially not only the regular use of lavana, but the excess quantity of lavana. That means if we want to cure the disease within a short period or completely, we can say to the patient, advise the patient that no salt for you at all. That will be helpful to cure the disease, sure. In Sushruta Samhita, see now, Amla test, that is sour. In Sangraha and Hruday, again they have followed Charaka Samhita. Bhav Prakash Samhita had made the combination of all, that is the Lavan and Amla. Now, for a physician, only to follow Charak Samhita, that is the Lavan test, is not advisable, according to my opinion. So we should avoid Lavan and Amla both test for the particular Pathya description. Now, next to that, we will go to the Viruddha Ahara, that is Krama Viruddha. Now, most of the time we say that no, the bananas are good and the milk are good, but one is having hot property sometimes and one is having cool property. So in Charak Samhita it is explained that the Shita Ushna, hot and cold, Viruddha Ahara, as well as first Krama Viruddha. Means now see the summer season is there and we are feeling very much hot. So I had traveled a lot in the afternoon time in sunlight in summer season, and immediately after going home, I have bath with the cold water. Now this is transgression of prescribed order, Shitoshna Krama Sevana. Now in Maharashtra or almost in India, we have a tradition that whenever a person or a guest is in our home, we serve first water, and then after immediately we offer the tea. Suppose sometimes you don't offer the water, the guest uh, asks you for the water. So it is like that. So it is actually a cause for hot cold transgression, means krama. Immediately, either cold first or hot first, whatever it is, you are going to cause it as a skin disease hetu. Okay, so intake of food, santarpan apatarpan. That means you have Santarpana first, so you have something heavy you have eaten, and immediately after that, apatarpana. That is something reducing your fat. That kind of food is like so. Especially in the fasting, we are doing it either apatarpan and santarpan like that. Sushrut Samhita has specially mentioned it. Immersion in water immediately after getting fatigued by exposure to the heat, just I have mentioned, is the cause of skin disease according to Sushruta Samhita. Now see, the third one is Viruddha Ahara, but it is now Bhojana Viruddha, that is incompatible food. Means together we are making some different combination. Now Charaka Samhita has mentioned chilchima fish with milk, then fish meat with milk. Now here, simply we can explain fish is having Ushna Virya, and the milk, wherever I mentioned it's a cow milk, it is having Shita Virya, that is the cool potency, and fish is having hot potency. And that's why together this combination makes it Bhojana Viruddha, or we can say those combinations are not at all advisable. We say, sir, we are in Maharashtra not eating this chilchim fish with milk, even though any fish is having hot potency and the milk is having cool potency. So fish with meat is also a causative factor. Now, when I discuss with some of our Japanese patients or the friends, they do advise us fish we cannot avoid, sir. So I recommend them that who live with this skin disease. In Japan, almost 90% people are suffering from the atopic skin disease, in which there is a dryness, and they are not ready to avoid the cause, that is the fish eating. Even the single fish is vitiating kapha dosha, that is aquatic all animals. They are also causative factors. Anyway, coming to the point, Sushruta Samhita has mentioned the foods such as incompatible, overeating, and unaccustomed. What is unaccustomed food? Unaccustomed food means specially which is not habitual with you. In suppose Punjab, they are eating curd daily or lassi daily, but in Maharashtra it is not habitual for us. It is unaccustomed food. So this is also a cause for skin disease according to Sushruta. Ashtanga Sangraha Samhita. Now you will be surprised to know that eating green vegetables like garlic, moolak, and then after that drinking milk. This kind of sequence is incompatible. That is causing skin disease. Again, other things are also described in Viruddha Ahara. Hridayala also, Ashtanga Hridaya has also mentioned Viruddha Ahara. Madhav Nidan has explained about the consumption of incompatible food also. And the priorly in the list of causes, it is mentioned in Madhav Nidan. Now here you can see in the causative factors, I have almost compiled from Brihatraya and Laghutraya. So you can see what is the contribution of other texts also. Charaka Samhita is the best one in Chikitsa, no doubt. But we have to read Charaka Samhita in light with the other classical text. So that is the contribution of other textual, our sciences or textual books also. Now about Snehanasi, we most of the times say, oil is good, cow ghee is good, but the oleation therapy, if it is not proper, it is excess, it is also cause of for the skin disease according to Chak Samhita. Ashtanga Sangraha Samhita has mentioned that without considering dosha, doses, not at proper time or after it, if consume non-recommended food and non-recommended behavior, then it will cause the skin disease. That's why even though Snehana is a Sangshamana Chikitsa or palliation therapy, we have to consider here specially about those kind of rules and regulations of Snehana, whether it is Bahya Snehana or Abhyantara Snehana, followed the same lines of Ashtanga Sangraha. so has also lines and Sharandar mention proper food and the doses that improper food activity at the time of
हॅलो सर, आवाज येत नाहीये सर.
हो सर, आवाज येत नाहीये सर प्रॉपर, म्हणजे काहीच येत नाहीये.